Okay, so here is the skin removed. You can see it's not a huge amount, but you don't need it. Jabor with Cosmetic Surgery and Laser Center of El Paso. Today we're going to be performing a lower facelift and an upper blepharoplasty. This case is going to be performed here in my office with oral sedation and local anesthesia. No need for general anesthesia. So the goals of the case are going to be as follows. So we're going to remove some of the extra skin from the upper eyelid area. We're going to correct the jowling that you can see right here. We're going to lift in this midface and restore volume to the midface. And then the last thing is we're going to get some tightening of the skin of the neck. I'm also going to use a little bit of fat for fat transfer. We're going to place it right here in the inner corner of the lower eyelid, here in the laugh lines, and then right here in what we call the pre-jowl sulcus. So that's what we're going to do, and I'll show you the steps as we go along. So we're going to get started with the upper blepharoplasty first. So I've marked this ellipse of skin. So while the patient was sitting upright, and I checked it to make sure that this is the amount that I could safely remove. So ready to go ahead and make this initial incision here. And so, of course, it's been injected with local anesthesia, obviously, because the patient is awake. She's just sedated. So we'll make that incision and then make this upper incision. And then once they're both made, I'll go ahead and remove that part of skin. And it's really, I'm just removing skin only on this portion. It's not muscle or nothing else associated. So I'll go ahead and take off that piece of skin that I have, that I've incised, and I'll show you. Okay, so here is the skin removed. You can see it's not a huge amount, but you don't need a huge amount. You can never remove too much, because then you're gonna be able to close the eyes. Right underneath here is the orbicularis muscle, and that's the muscle that helps close the eye. So you can see we're just at the skin itself and not deeper. Now sometimes what I do is I'll go over here and I'll remove a little bit of fat if I feel like there's some, but really only on the inner corner. I don't like to remove it too much there because I don't want to give a skeletonized look later. So I'm beginning to close now, and this is what's called a subcuticular stitch. So it just goes right underneath the skin, weaves back and forth, and then in about 5 days we pull this entire thread out or stitch out. And you can see how nicely that's closing. We'll close the entire incision like that. Patients marked and we're prepped and ready to go. Of course, the first thing I need to do is inject some of the local anesthesia so that we can get good pain control, since we are doing this under local. So here, this is what's going in. This is the same solution that I use to do liposuction. However, it has a bit more of the local anesthesia since the patient is going to be awake. So I'm going to inject this into all the areas that we're going to need, and then we'll come back and I'll show you the next step. So I'm going to go ahead and do a little bit of liposuction here of the neck, and right here in this jowl area. There's 2 areas I'm going to do it on. So I'll continue here. We'll just remove just a little bit of fat. You don't need to remove much, and it gives you what you want in this area. Next maneuver is I've made this incision, you can see here right under the chin. I'm going to elevate the skin here of the neck so that once I do these incisions that go around the ear, I'll be able to redrape that skin very nicely back towards the ear. So, but we need to go ahead and elevate this skin first. So I'll continue doing that, and then we'll move on to the next step. My assistant's going to be closing the eyelid incisions completely, and I'm going to start here with the face. So I make this incision here, kind of goes at the sideburn area, and then in front of the ear. And again, this has all been anesthetized with some local anesthesia. And then it continues on but behind the ear. And then the last part of it goes into the kind of this junction right here where the hair and the skin meet. People will sometimes bring it into the hairline. I kind of like to put it right at the junction so it doesn't change the hairline at all. And now I'm going to get busy elevating that skin. Done undermining, you can see here, undermine all the way to the middle part there. So all this is nice and undermined. And so now what we're going to do is get this layer underneath the skin, so we've gotten access to everything we want. And we're going to put some sutures to elevate this or tighten the so-called SMAS layer. So that's what we'll do next. And then you'll see once we do that, this skin will be pulled back from the SMAS layer, and then we'll just trim the excess skin, excuse me. What I have here, I'm suturing is a layer underneath the skin, and you can see what that's doing. It's giving a significant pull, and then once we bring the skin back, it will take care of the excess skin. So I'm going to continue with putting these sutures in here, and then I'll show you the excess skin we have after putting plication or putting sutures into the SMAS. So now you can see I'm putting really very little tension on the skin there, and you can see this excess that's just going to come right off. That's just because we've tightened underneath and pulled up. And then I'm going to do the same. We'll do the same for here, for the face portion, and same concept. You can see I'm really putting very little, and then you can see, you know, how much is going to be removed. So that's because of the elevation that we've had with the SMAS layer that's been tightened, and not because I'm pulling tight on the skin. So we're all done with the kind of cutting the pattern back out for around the ear. I put a couple of deep sutures, and now so we're ready to put the skin sutures, and we'll be done with this side. One more thing I'm going to do is I'm going to put some net sutures right here, just so that the skin really gets tacked down to the underlying tissue and helps prevent any accumulation of fluid or blood. So the last thing we're doing on this side is we're putting in these hemostatic net sutures, which are going here in this horizontal row. You can see I've already got on here, and that just, like I said, it helps tack the skin down to the deeper layer of tissue, and then it also prevents accumulation of fluid or blood. So we'll do another row or two, and essentially we'll be done with this side here. So we're all done with closing here the facelift incision, both in front of the ear and behind the ear. Just in a little bit of fat for the fat transfer. We're finishing up on the second side, so we're getting close to being done. This is usually the last step, is the fat transfer, so we're getting this prepared right now. Last thing is just putting some fat. As you can see, it's already loaded in this small syringe. I have a blunt tip cannula on here, and I'll probably put just a little bit more there, and we're going to do it, put fat also in this nasolabial fold and this medial cheek area, and we'll be done. And so just to reiterate, we did the upper blepharoplasty, we did the lower facelift that has the incision that comes from in front of the ear and then behind the ear. Also made that incision there to elevate skin. We worked on the SMAS, or the submuscular aponeurotic system, and the last thing we did was the fat transfer. So here we are, completed, done under local anesthesia with sedation in the office. I'm Dr. Mark Jabor with Cosmetic Surgery and Laser Center of El Paso. If you like what you saw, please give a thumbs up. If you want to become a subscriber, you can see all the latest content.